Welcome back to Catalyst University. My name is Kevin Tokoff. Please make sure to like this video and subscribe to my channel for future videos and notifications. In this video, we're going to be going over exercises and other therapies that can be used in the treatment of DeQuervain's Tenosynovitis. This quote is one of my favorites of all time because it's applicable to almost every aspect of life. If it doesn't challenge you, it doesn't change you. You could easily make an argument that this is applicable to every condition that you see in a physical therapy clinic, but there's some conditions that it's very applicable for, like DeQuervain's Tenosynovitis. And that's because with a condition like this, the exercises we're going to cover, among others, are going to cause discomfort, and it's pretty much unavoidable. So understand there will be some discomfort with these exercises, but that does not mean that you or your patient need to be pushing so hard that you're substantially increasing pain. That's not the point of these exercises. The point is for these to be a challenge. These first three exercises are about the gentlest and easiest that we're going to see. That being said, they're perfect for acute DeQuervain's Tenosynovitis, or if the patient just comes in and happens to have a lot of inflammation in that area. The first exercise we're going to look at is the thumb lift. This can be done either as a stretch or for repetitions through active range of motion. You're going to have the palm on the affected side face up, and the other hand can hold these 4 digits down. And the thumb is going to begin in this position, and then you're going to actively move it over to the base of the 5th digit or base of the 4th digit and hold it there. And this is a stretch that's going to really target kind of the muscles on the outside of the thumb that you can't see right there. But being a stretch, you'd probably hold it for about 30 seconds. Or you can go through active range of motion like this, targeting the same spot, and do that for repetitions. That's the thumb lift exercise. The second exercise here is the opposition stretch. For this, the palm is also going to be face up, but this time your other hand is going to hold down only digits 2, 3, and 4, not the 5th digit. And then the thumb is going to move in such a way that it contacts the 5th digit like you see here. Now right there, I'm just going through repetitions in active range of motion. But you're holding down digits 2, 3, and 4 and bringing the 5th and 1st digit together. You can also hold this as a stretch. Again, being a stretch, I would say hold it for about 30 seconds. To perform the thumb flexion stretch, you're going to have your palm face up again, and you're going to use your other hand to bend the thumb on the palm in such a way that it lies perpendicular to the 3rd digit. So there's my other hand bending that thumb, and now it's perpendicular to the 3rd digit. And again, being a stretch, you'll hold it for about 30 seconds. Next, we're going to look at the Finkelstein Stretch, which is really just an adapted form of the Finkelstein test, a special test used in the diagnosis of DeQuervain's Tenosynovitis that we saw in the previous video. The less intense form of the stretch is shown right here. You're going to have one hand out like you're about to shake somebody's hand, and the thumb is pointing up. And then the other hand is just going to stretch the wrist into ulnar deviation like this. And this gives a nice stretch of those tendons right here of abductor pollicis longus and extensor pollicis brevis, which are normally implicated in DeQuervain's Tenosynovitis. If you want to make the Finkelstein stretch more intense, you're basically going to make a fist around your thumb like this. That's what it looks like in the other hand. And then you're going to use that other hand to stretch that wrist into ulnar deviation. Again, getting another stretch of that abductor pollicis longus and extensor pollicis brevis. You're going to hold these for 30 seconds. Again, the reason why grasping the thumb makes this more intense is it puts a little extra stretch on those 2 tendons that we just mentioned. Now let's take a look at the wrist flexor stretch. Basically for this, you're going to use one hand to bend the other wrist into extension, which then gets a stretch of the wrist flexors on that side. Right there, you're seeing a unilateral form of the stretch. To do the bilateral form of the stretch, I'm going to do what's called a prayer stretch. I'm going to put both palms together, and then while keeping them as close as possible, I'm going to lower the arms as you see right here. And this is going to provide a stretch of both wrist flexors at the same time. This is a wrist extensor stretch. I'm using one hand to stretch the opposite wrist into flexion, which is then giving a stretch to these wrist extensors right here. Obviously, this is the unilateral form of the exercise. The bilateral form is going to be the Phelan stretch. The reason it's called this is it's named based on the Phelan test, which is used in the diagnosis of carpal tunnel syndrome, which we'll cover later on. But basically, you put the dorsal aspects of both hands together, and then you bring the arms up, and it stretches the wrist extensors on both sides. If you notice, the prayer stretch from up here is exactly the opposite of the Phelan stretch down here. The prayer stretch, the palms are together. In the Phelan stretch, the dorsal sides of the hands are together. Now these next three, wrist flexion, wrist extension, and wrist radial deviation, I'm showing you the resisted form of these exercises. You can hold a small dumbbell, a can of soup, any kind of a weight, or even use a TheraBand. These can also be done without the weight, just through active range of motion, if resistance causes too much of an exacerbation of the pain. Note that for all three of these, regardless of whether it's resisted or active range of motion, the up and down phases should be about the same duration. Next, we're going to look at radial deviation eccentrics. These are normally done when the DeQuervain's tenosynovitis is chronic. There's no active inflammation, and the pain is generally pretty low. The rationale behind eccentrics is we're trying to actually induce a little bit of micro damage to these tendons in order to jumpstart the healing process. So that being said, if we're trying to jumpstart the healing process, we're trying to jumpstart a little bit of inflammation. So we do not want to follow this treatment with ice because we'll undo everything that we did. When you're doing eccentrics like this, the down phase is going to be about 5 seconds. And then the up phase is assisted either by the person's other hand or by the physical therapist. And then you undergo another down phase. So really emphasizing the eccentric component of that wrist movement. And then you're going to do about 10 to 15 repetitions of these. Again, after you do eccentrics on any body part, you never follow with ice because you'll undo that inflammation that you actually wanted to induce in the first place to jumpstart the healing process. Along the same lines as the eccentrics, we also can choose to use A-stim for chronic, less inflamed cases where there's also low pain intensity. You're basically going to take a tool like this and grind over these two tendons, abductor pollicis longus and extensor pollicis brevis, in the direction of their tendon fibers, making sure to avoid the styloid process. And again, by using this A-stim tool, you're trying to induce micro damage or micro tears, which will then jumpstart the healing process. If this is in an acute phase and there's a lot of inflammation, you would not use A-stim. Now understand that I'm well aware of the lack of evidence for using therapeutic ultrasound in the vast majority of cases. However, for some patients, ultrasound works really well for DeQuervain's tenosynovitis, and it probably has to do with the fact that the tendons are very superficial, very close to the surface, and easy for the ultrasound to hit. Generally speaking, you'd use a duty cycle of 100%, and because the tendons are very superficial, the frequency is going to be 3.3 megahertz, or if your machine just has 3, it'd be 3 megahertz. You probably want to start with an intensity that's pretty low, so probably about 1 watt per square centimeter, and make sure to avoid that styloid process, because remember with ultrasound, you can cause bone to heat up a lot. Bone heats up faster than tendon, fat, and so on and so forth. So make sure to watch that styloid process, just like you are for A-stim, but for different reasons. Next is grip strengthening. So grip strengthening is pretty straightforward. You can do this first like you see over there on the left, just doing it for active range of motion. But if you want to progress this, you can do resisted grip strengthening. You can take any object at home, whether it be a small washcloth or a pillowcase like you see there, crumple it up into a ball, and then squeeze that. Now, regardless of whether you're doing the active range of motion or the resisted the most important part of the movement is really when you get to the end range of that squeeze, really holding that squeeze to strengthen the muscles involved in grip strength. Again, with this, you can use a towel, you can use a rolled-up pillowcase like you see here, and some people even have access to stress balls. You can use those as well. Obviously, if the object you're gripping becomes too easy, you want to make sure that you're progressing to an object that's harder to squeeze and gives a little more resistance. The last exercise here is called the finger spring. I prefer to do this one with the palm face up. You basically bring all the digits together and then kind of unfurl them and extend all the digits away from each other. So on the left there, you see me doing this for active range of motion, but just like grip strengthening, I can progress this to doing it against resistance. That's what you see there on the right. I'm using a hair tie that I found in the Airbnb that I'm staying at right now, but that's basically what you do. You wrap it around all the digits and then you attempt to spring all the fingers outward. Now when you do this, you're probably not going to be able to separate digits 2, 3, 4, and 5. All you really are focused on is getting that thumb away from the others. So as long as you're getting a movement like this, it's perfectly fine. If the hair tie is too difficult, you can regress it to using a rubber band, which doesn't provide as much resistance, so it's a little bit easier. Remember, with DeQuervain's Tenosynovitis, if it doesn't challenge you, it doesn't change you. So hopefully this video gave you a good understanding of a lot of the treatments that you can use to treat DeQuervain's Tenosynovitis. Thanks for tuning in. Please like, subscribe, and check out my Instagram for cool science and not science stuff.